coronavirus crisis has a major effect on the people working on the front lines. They have been collecting and transporting supplies, caring for sick and older people, and keeping trees and buildings clean. They have watched their co-workers get sick. Thousands have gotten sick themselves. Many have died. Frontline workers in the United States are mostly women and people of color, and are more likely to be immigrant workers who have been declared essential during the crisis are also more likely than the general population to live at or below the federal poverty line. That information comes from a recent report by the Associated Press (AP). AP. Reporters look at population data from the country's 100 largest cities. What is important about this pandemic is that it has shined a spotlight on workers who have always been essential, but before this were invisible, says David Michael. He is a professor of environmental and occupational health at the Milken Institute School of Public Health at George Washington University. Born homeless in New York City, Courtney Brown is no stranger to life's struggle. She and one of her sisters both work at an Amazon Fresh storage center in New Jersey. They live together in the city of Newark. In most major cities, more than 60% of storage business and delivery workers are people of color. In Newark, that number is over 95%. Brown is among them. When the pandemic began, Brown worked extra hours at her job as a supervisor to get the two hourly pay increase. Soon, several of her co-workers became infected. Others, she says, did not come into work at all. One day, Brown felt very tired and in pain from a tendon condition. She did not feel like going into work, so she stayed home. That morning, her phone rang over and over. She threw it across the room. I thought this just isn't what is, she told the PA. Of the many kinds of frontline workers in America, food store employees are among the most visible. James Lewis worked at a Safeway food store in Damascus, Maryland. She has worked there for 27 years and knows many store customers. Some has bought her sweatshirts during the pandemic, but other customers have not been so nice. One woman shouted at her for not wearing protective covering on her hand. Nationally, at least 16% of food store employees are estimated to live below the federal poverty line. 15% lack health care insurance. The virus has killed at least 30 members of the United Food and Commercial Workers International Union, which represents 900 people. Another 300 have either gotten sick or been told to stay at home. The worker rights group say, when Estee Lewis gets home, She removes her shoes and changes clothing. She cleans her shoes with special chemicals. Her work clothes immediately go to in the washing machine, and she washes her body. She does not want to risk infecting her husband or her 15 years old granddaughter who lives with the couple. I didn't know I had anxiety until this task. Louis says, Louis says, Juan Gardo and his wife nearly lost their home after he lost his job during the 28th financial crisis. A refinancing didn't save them from losing their home, but they were left in debt. Girano, who is based in Los Angeles, California, drives a truck for a living. He has seen his workhouse reduced as imports low. He gets fewer than 4 deliveries a week, compared with at least 12 in normal times. He used to make $3,050 a month. Now he is earning about $1,050. More than 85% of warehouse and delivery workers in the Los Angeles area are people of color, and 53% are foreign-born. Girardo was raised in Colombia by his grandparents after his father left the war-torn country to find work in California. Girardo did the same in his early 20s. As a contract worker, the farmer of 4 gets no basic level and depend on California state health insurance program. They are called as heroes, Girardo said, but it's like they are sending us to World War II with wooden pistols.